or some people call that Peking University. So he had a dual degree from Beijing University. One is environmental science, and the other one is mathematics and applied mathematics. Luyu graduated from the master's program in 2019, and he's currently a PhD student. So he is going to apparently Luyu has been working hard during quarantine, I guess. So he's going to present his recent publication on the impact of COVID-19 on public transit. Luyu, the screen is yours.
Okay, here it is. All right. So hello everyone. Good afternoon. My name is Luyu Liu. So this is one of our recent studies on the impacts of a COVID-19 pandemic on the public transit demise in the 113 transit system across the United States. So today I'm going to introduce some of personal experience as per se, and also some motivation, some methods, and finally my favorite some insights into these these impacts of the COVID-19 pandemic. So the first I was going to introduce you is my motivation. Oh, there it is. So if you are a transit lover as me, you must have seen this title very often. I mean, back in March when everybody is panicking and rushing to the store for the toilet paper. So across the United States, that we are facing a transit crisis. The crisis that nobody will take a transit anymore because for obvious reason. But however, I noticed that across the United States, for different transit systems, we see different numbers, right? For example, like Seattle, they lost 60% of riderships. However, for Houston, they only lost like 29% of riderships. For some like these more extreme cases, like Sacramento, they lost like 90 to 95% of riderships. So I was wondering, okay, why? Why this different? And what's more important is that who is using transit during a pandemic, right? Based on these motivations, I have these several questions. So first, how many people continue to transit during the lockdown? And moreover, who are these people and what factors, including social demography and economic and different factors that could correlated to the demand. And beyond this, I want to ask how the ridership in different cities respond to the pandemic. And finally, how did the pandemic reshape our commuting patterns? Before we jump into questions, I want to introduce our data source because as you know, it is very hard to quickly get the data from like even one transit authority to finish a timely research, let alone we have the whole transit system across the United States. So we also face other issues like different standards and incompatible protocols across different systems. So we actually find another path. We resort to a third-party data sets that derived from the cell phone apps called Transit app. If you're not familiar with the Transit app, basically is WISE, so for buses, right? If you drive, you will need navigation. So likewise, when you ride public transit, you will need a scheduled routes. And beyond that, it will need to know where the buses is and which route you will take. And it will show all the information and we will schedule that for you. And it becomes very popular across the transit users across the United States and Canada. It could plan your trip before you actually take the transit. So we take this data as our base. And as you can see in the right, this is a whole map of our data sets that covers they contains 113 county level transit system in 73 metro areas and 28 states. And as you can see, this is a very large spatial coverage. And you must be asking, okay, this guy talked a lot about this cell phone. Seems like very fishy, but how about the actual performance? Can it actually represent the users who actually take this transit? So there were several facts that I want to introduce before I jump into the conclusion. The first one is it has a very large user base of 1 million users across the United States. If you know that transit user in the United States, you will know that there is almost 7 million transit users across the United States, and among them it is almost 1 million user who use this app. And beyond this fact that we actually tested those, the performance or representativeness of these data sets, that we select different official data from the news and from a authority report from different places we can ever find on the internet. And we compare these two data sets that provide official and the transit data. And we find no bias in terms of like a statistical point of view. And the last I want to say about the regular passenger count data is that, which is the traditional data source we use, is that it become not very reliable during the pandemic like this one, because like COTA here, they issue a lot of policies that combat this contagion of the virus. They actually do not allow you to board from the front door to avoid the contaction between the drivers and the passengers. And also they do not, you do not need to pay to get a ride because for obvious reason. But however, that will disrupt a lot of like a measuring process that's made our traditional data sets not very, very reliable. So after we decide our data, the first question I want to ask is that how many people actually still demand this transit don't get locked down? To do this, we analyze the transit declining process by using a logistic function modeling. As you can see to the left, this is the transit demand for every day from February 15 to May 17, or for almost the 3 months. And this one is in Austin. As you can see, it fits perfectly in terms of like a statistical model. And based on this modeling, we can actually derive different parameters from this model to represent different aspects of this decrease process, so that we can measure, for example, the most interesting one is how many people were still using transit during lockdown, which is measured by the base value I circle. So based on this value, we calculate the same value for every 113 system across the United States. And here is a map. So as you can see, there is like two polar, and I would say two rivalries between the north and the east, north and the south, east and the west. For example, in the California especially, you see a lot of people are not using transit anymore, which means the decrease in the demand is very large. This is very intuitive because California is kind of like it gives you a sense of a transit kind of leaning, right? But in fact, more interesting is that the Midwest and the Deep South are actually using more transit compared to the other places during the lockdown. And you can see here a lot of light dot here and the Deep South. So you can see this is very different and heterogeneous for different places. And you can see, we can also see some regional patterns over there. So I want to ask another question, which is, who are still using transit and what factor determine that pattern we just saw? So we first did a regression analysis. So we determined that 4 categories of factors contribute to the base value, which is the higher transit demand during the lockdown. So from the high to low R-square increment, Someone's chat. Okay. From high to low R-square increment, there is a 4 tier. The first tier is African-American women in the city, which means the more African-American and women population in the city, generally the higher the usage during lockdown will be. And the second tier is occupation and essential jobs and Hispanic people. Occupation specifically is essential jobs for people who have to be present to finish their jobs. The more these people are in the city, generally the higher the usage the transit will be. And also the more Hispanic people in the city, the more transit the city will be.
So I'm not sure, is that me or is Luyu?
I think that's me.
Okay.
Where did I lose you?
I don't know. You stopped sharing screen now. So can you
Okay.
share your screen?
Oh, sorry.
Yeah. No worries. This happens when you do this online. So
especially when you do with the Spectrum, thanks to my precious internet provider. Where was I? Nishan? Where was I?
well, I think it's about here.
Okay, I will start from. Sorry about that. Anyway, so I was saying that we did a regression analysis. So we find that 4 category of factors contribute the base value, which is the higher transit demand during the lockdown. So from the model, regression model, we find out that we have basically four tiers of factors that contribute to the base value, which is the usage during lockdown. The first tier is African-American and women population in the city. So basically, the more African-American and women population in the city, the more usage the city will be. The transit usage will be. And the second tier is occupation and essential jobs and the Hispanic people. The more people doing essential jobs, the ratio in the city and the more Hispanic people in the city, generally the more usage, the higher transit demand during the lockdown it will be. And the third tier is age for people whose age is over 45 years old in the city. The more senior people there is, the more usage it will be. And you hear this right, the more. And the last one, which is actually the least important one, is that your awareness of the pandemic, which means the more you search on the Google about the coronavirus, which is the keyword, the less you're going to use the transit. So in that sense, it's kind of ironic because your race, your gender, your job, and the age matter more compared to awareness. So I'm going to introduce more with a parallel user survey conducted by Transit. So they survey 25,000 people across the United States and Canada on the active user during the April when there was a total lockdown, everybody stayed at home. So first the tier factor is African American women. As we said before, that we find in the regression analysis that the African American women has a strong positive correlation with the usage in the city, and it is so, and supported by the survey, because pre-COVID and if you compare pre-COVID and COVID, the African American percentage actually increased for 13%, and while white people actually decreased by 80%, which actually become the minority in terms of the ridership afterwards. And what's more interesting for me about this whole survey is that the sex ratio before COVID-19, in the riderships, female to male is basically 1-to-1, but afterwards it became 3-to-2, which means there were more females riding transit during the lockdown than male. And also, to be clear, this is not an absolute value. This is a proportion of different population, which means for the case of female and male, it is that more male actually stay indoors during the lockdown because they have the choice. And for some extreme cases like Philadelphia, even more than 68 of the writers are women, which is kind of scary and for me, this is a kind of very dark reality for me, because it seems like we as a whole, as a nation, that we are pushing women to the front line during the health crisis. And beyond that first tier factor, we have the essential worker factor. Like I said, more essential factors in a city, generally the more usage the transit will be. And it is actually supported by the user survey conducted by the transit, because as you can see from the top to the down is arranged by who is still using transit by percentage. As you can see, like food, healthcare, sales, healthcare, and building, these people are actually the essential workers who have to be present to finish their jobs. So they need more public transit, don't get locked, even during lockdown, because they must do their jobs, right? Don't have a choice. And below there, they're actually like management, engineering, legal, and of course, like live social science like us. We are actually the privileged population that can stay inside to avoid this crisis in a sense. And in the same tier is the Hispanic people. And from the statistic of from Bureau of Labor Statistics, Hispanic people actually have the lowest percentage to work remotely. And also what's more interesting is that Translate App survey also showed that Spanish-speaking users' ridership decreased less compared to English-speaking user. In other words, if your operation systems of your phone is Spanish, the chance of your continuing to translate is much higher than those with English. And after all, we came to the third tier, which I think is the most ironic tier, is that there was more seniors after the pandemic. And consider the fact that the most vulnerable people is themselves to the virus, more senior people actually are correlated with higher transit demand in the city. And as you can see from the survey result from transit apps, the younger population, especially for people between 25 to 44, were actually taking less transit, while the proportion of older population drastically increased during the COVID-19. So after answering who are these people, I have this idea of the whole picture of the riderships during the lockdown. I want to ask this question and go from the very beginning, that how quickly do we as riderships respond to the health crisis? Because intuitively you need to avoid transit because of its collective nature. But during that, and right now we know that it is not generally true from our knowledge right now. But back in May, and before May, from February to March, during this time of a dark age that we know nothing about this virus, we just intuitively assume that people need to avoid. And how do we actually respond to this? So we compare two important days. The first day is the first day of demand decrease, which I called cliff point. It's like you're driving and there is a cliff and it just plunge and hit the ground. And it's exactly like the curve shows. It's like you have the very stabilized level before the COVID-19, and then you experience a rapidly decrease, and then you restabilize, and this is where the decrease finished. And we compare the first date of demand decrease, and then we compare another date of first community spread, which is where and when the virus actually hit you. So we need to make sure that we need to, kind of start to evacuate before the pandemic, the local spread actually hits. So we calculate the response interval between these 2 points and see, how different cities, different communities performs during the lockdown. And it actually show how timely did the city and did the transit riderships respond to the pandemic. And this is the big picture here. So you can see this is very similar to what I showed you in the last map. Still, we have, especially for the Midwest parts, so despite what we are right now, but we were actually the earliest region to respond to the pandemic. And we actually did very well in the very beginning. And if you can see beyond that, beyond the Midwest part, we can also see like Boston, Chicago, Seattle, Los Angeles. These places are very blue, which means the response way earlier, way later than they should have been, because that's like the first wave they hit. And I guess many of you have been wondering why we are using the day of first confirmed case as a day of a community spread, which I know this is not right, because way before the first case emerged, the ridership may have already been imposed to the virus, because as you know, COVID-19 have a feature that it can pass the virus even if you don't have any symptom. So we need to consider an incubation period, but for the case of a COVID-19, it was 5 to 14 days. So after we apply this incubation lag to the calculation earlier we did again, so we find out that among 113 systems, for the default setting, which is I should just show you, 58 of them can respond timely. But if you apply 5 days earlier, only 32 can respond earlier. And for incubation lag equals 14, only 6.1 can respond timely, which totally shows that we are not very prepared and we are very late. But I would say there were still some good things, which I call this the silver lining, is that it seems like our policy does matter, because we find out the early cliff point where the first day for the ridership to respond to the pandemic is positively correlated with early declaring emergency date, which means we find, basically what we do is that we find every city, every transit system cities, and when did they declare the state of an emergency, and we compare these two, and we find out there was definitely a very strong positive relationship between these two. And that says that transit user response time, although were not synchronized with the evolution of a pandemic, which is bad, but it is with local community action and policies, which means if you do something, it will make impact. So finally, I wonder how did the COVID-19 reshape our hourly demand? Because for before, although everybody is commuting, but afterwards only the mostly essential worker are commuting. So I'm wondering, what is their routines has changed during the lockdown, and also besides daily, I want to see hourly, because all the analysis that I just introduced is based on a unit of a day instead of a moreover and a deeper dive into the data. So this is the hourly transit demand profiles. In the left, I show you one typical weekday in MTA New York City subway, which is one of the largest public transit system in the United States. So the orange line is the hourly transit demand before COVID, and blue is during COVID. As you can see, this is definitely a lot of changes in terms of like quantity, but I wonder beyond that quantity, I wonder what is the similarity of shape between these two curves. So that's where I apply, I just code the backup and apply this called the procrastinated distance analysis, and we calculate the difference between the shapes, similarity of the shapes between the two hourly shapes, and they actually show these measures how much did the hourly demand change in terms of like shapes. So this is like the spatial part of the distance, the measures I just introduced. As you can see, this is also very similar to the first map I show you, especially for California and some of the Midwest and some of the deep South. And they are actually indeed is correlated with the usage, because the more the usage has decreased during the lockdown, intuitively it is your routine just to change more and your hourly pattern will change more. And that is proven to be true in our analysis. And finally, I want to introduce something very interesting for me, is that for me personally, after the lockdown, I feel like my work just become every day is Monday, and I feel like every day is the same. So I'm wondering, what is the difference of the weekdays and the weekends have changed before and after the COVID-19? So it actually turns out to be true. Like afterwards, before the COVID-19, I show you here is the MTA NYC subways, typical Friday, Saturday, Sunday, 3 sequential days. And you can see before the pandemic, which is shown in the blue lines, the Friday and Saturday and the Sunday shapes is very different. Like a Sunday, many people are not working and you can just go shopping, but actually afterwards, everybody's working. And as long as you're commuting, and it is very high probability you are a essential worker. So for whom every day is a work day. So in that sense, you can see every day, Friday, Saturday, Sunday, we have a peak hour. And that is something that's very, I would say, deep and ugly. So finally, what can we learn from all of these? I mean, we show a lot of results and a lot of numbers, but what do we learn? First thing I want to say is that public transit is essential. It actually shows that people were actually using transit even during the lockdown. People need transit system even during a health crisis because of their lives. And who are these people? These people are the vulnerable, the minorities, the poor, essential workers, the ones who have no choice. So I think we need to rethink the roles of public transit as a whole in our society, that public transit should not be a business. It's not something that we use in our city to attract a business or tourists and just to show, mercy to those who have no, who have no choice, and it is kind of like social welfare. No, but actually we need to regard it as a crucial urban infrastructure, as something like a road, like a highway that we put there to serve people, because as you can see here, people actually live on that. And the second point, I want to rethink our response. So as you can see, and probably to everybody's common sense, we were very late, the US as a whole. But there was still a silver lining that despite the chaotic situation in the higher level, local communities' policy did make an impact. If you declare the state of emergency, even if it is just a gesture, you can still make people aware and avoid transit as soon as possible, because that will potentially give them the higher chance of contagious when we know nothing about the disease. And mobility, I want to say, is that it is not dependent of public policies and economic activities. Mobility as itself is not like it's not like a house and not like a business. It's something like a bridge that connect different places and activities. So in that sense, I want to say mobility research should not be independent from anything. So as a mobility scientist, I want to pay more attention to a social perspective and social equity and economic activities, more of these. And finally, I want to rethink of our future as a mobility, how this mobility system goes in our future, and what is our vision of a more equitable mobilities. So down there are two graphs that is not randomly selected. To the left, we have actually the cover of, this the cover of the U.S. Department of Transportation's promotion materials about the self-driving cars. As you can see, it promises us a bright and beautiful vision that all people with suits and robotics will just watch, see there, and a white car with a very poorly optimized inner space, with big smiles. And of course, one of them must be black and one of them must be women, since that's definitely equitable, right? But in actually, to the right, what we see is that our people, especially the vulnerable and people of color, are actually suffering from the poorly services, and the livelihood is destroyed because the pandemic and the poorly funded system. Our system is not okay and crying for financial and policy support, and it's not like you're going to bail out the airline and then just give us 24 billion for the whole United States and say, okay, just deal with that. In fact, I would say something like the futuristic, beautiful, like flying cars are indeed tempting. And I am one of those, if you know me, that I am one of those who are very interested in the technology innovations. But let us not be lured by this beautiful vision that may not benefit the public in decades. Instead, let's focus on the dark and ugly reality that our essential workers and minorities are risking losing their jobs because we do not have money to support the transit systems. And to be clear, we do not have that money, which is that don't give the money to the public transit systems. So really, that's our the priority issue we need to think about. And the last is this is as Ning-Chuan said, this is a published paper. So if you're interested or have any question, please feel free to ask me anything. And please check out the paper we published on the PLOS One. And thank you. And I think anybody have a question?
All right, thank you, Luyu. And again, we'll ask the graduate students and the students in general to ask the questions first. Any questions? If we don't, elbow seems to be yeah,
jumping at the bit. Luyu, did you check your the ridership decline against car ownership?
Right, that's actually a very nice question. We actually checked that, and it turns out it is not one of these significant factors. The part of reason is that first, car ownership and car dependent are two totally different factors, and that is not measured in the census. And we can generally see and say, okay, if you don't have a car, you are transit dependent, but that is not usually the case for many places. Like if you have a car and you don't have the ability to pay for that, even if you have a car, you still need to transit. And that is the case. And there is many very common and undetected factor that could differ these whole things, the whole picture together. And we also actually tested the transit score, which measures how good the local transit possibility they measures. And also we also test the walkability in the neighborhoods. And that is not significant also. And that also says something about this pandemic, which I like this conclusion is that it is not about something that is built or built-in environment. It is more about your like social status, your economic, right? So, and sorry, back to your question. So we tested and it is not. Yeah, sorry.
Anybody? I do have a lot of questions, but let's see. Yeah, so I was wondering how bad is the public transit system, right? Not as bad, as poorly funded or defunded, but do people actually get sick on the public transit, right? Apparently, the sort of the advice from CDC and other people generally says, you won't get, sick on the airplane or in the, or in the shopping center or anything, right?
Mhm.
So it's rare for people to do that. And now, for buses, it might look terrible, but they might be having really good ventilation systems. So it's not that kind of scary in that sense.
Right.
Do you have any comments on that?
Right. That's a very nice question. So first, you're right. You're definitely right about the whole, the fact about public transit is not the primary source, or if there was any, risk about taking a transit during the lockdown, that would give the virus. No, there was a lot of sources I have already read, and as other people has published a lot of evidence about this, is that public transit is not a very significant sources of the contagious so-called the panic that everybody's having, as long as you wear a mask, of course. And the second I want to say about this paper is that first, this paper measures the first stage of the COVID-19 pandemic, where and when people know very little about this disease, and local government suggests that we should not take transit if possible, even right now. So in that sense, it is natural for user and even for me to be fear about to fear this whole transit and the collective crowded spaces as something like a transit. And that is just the reality. There is no evidence, although we know that it is not true, but as a psychological factor and as factor before we know about these facts, that transit is not spreading the virus as we imagine, people actually believe this. And this is what exactly we're trying to measure here, which is how, based on a falsely belief, and how is a kind of how does this fear about an unknown disease can affect the transit system, because in the future we will need maybe COVID-21 to COVID-22. But the point is that we also will be panic about this, and we also maybe to experience similar things. And that is one thing we want to learn about, this whole process of decrease process. How does this affect? And also, and that is the second point. And last point finally is that this paper is not to say it is good or bad to take transit. It is about more about the transit. It's more about describing the reality that when everybody's believing this and stop the use of transit, how does the remaining population, which is the essential and the minority, how does these people take the transit, and what factor does different kind of social demography and economic factors can contribute to the usage? That's the point.
Okay. Anybody else wants to? Not yet. So I was also wondering how if you compare the responses of public transit with the responses of the of cars, right? Of vehicles, of traffic in general.
Mm-hmm.
What should we expect, right? Mm-hmm. So would that give us some ideas about how the society generally responds to the pandemics? Maybe people the public transit might respond a little bit slower, behind the traffic in general.
Mhm.
Is something reasonable to assume, or should we look at the data and say,
Yeah, that's a nice question, and that was one of the paper I want to write about. But because of different changes, I decided that there was already a lot of papers talking about this. So I think I read some of the sources on different journal that already say something about this. Is that although we still have, I didn't see a whole picture of how comparing to specific process, like how transit decrease and how other mode of transportation decrease. But I can still guess that transit is one of those earlier to decrease, because I think I read something from Washington Post from May that's saying that public transit is actually the most that decrease the fattest and also recover the slowest. So that is a very powerful conclusion I remember, but I can't remember which specific paper it is. But as you can see, the cars is actually it doesn't really help the whole promotion against so-called green vision that we will use less cars. That because the nature of the pandemic, we tend to avoid this collective way of transportation, and this is not. It is not somebody's fault. It's just the reality, and this is a very unfortunate reality. So I guess I don't know if that answered your question or not, but there is definitely something that we can do in the future to actually to test it.
Yeah, it's good. It's good. Yeah. So does anybody else have any questions, comments? Right. So this has been a very good forum. So we will have another event on February 19th when Soo-Hyun and Emilio will be giving us, a snapshot of what they are doing right now. All right. So with that, I think let's thank Luyu. Give Luyu a round of applause. All right. Okay. So everybody has have a good weekend, and thanks for coming.
Nice job.
Bye.